Well, good afternoon, everyone. I want to start this presentation by introducing you to John, a 23-year-old male from Guinea who immigrated to Canada in 2015. He presented to the emergency department last year after his first seizure. But his story doesn't start here. So, what we've realized is that he's been leaving behind a trail of clinical clues for decades. It starts with him being in a coma for a week due to an unknown illness. And then over the past decade, he's experienced transient vision loss, headaches, more recently, nosebleeds, and now a seizure. But despite this history, he's otherwise healthy and his physical exam is completely normal. So we started with an initial non-contrast CT head, which revealed something interesting: a chronic infarct in his right lobe. A subsequent MRI revealed and confirmed multiple embolic infarcts, suggestive of an embolic pattern. But what about a CT angiogram? Completely normal vessels. An EEG? No seizure-like activities. An echo? Both transthoracic and transesophageal, completely normal. So we're possibly looking at chronic embolic strokes, but no obvious source. Then came the labs, which revealed a key clue: eosinophilia. Looking back into John's history, we realized that this was not new. In fact, he's had eosinophilia dating back to 2015 when he immigrated to Canada. So we're looking at persistent hypereosinophilia, but why? This led us to broaden our workup to include less common causes, which fell into three main categories: autoimmune, infectious, and hematological. Although his ANA and double-stranded DNA were positive, he had no clinical signs of an autoimmune disease. Bone marrow biopsy showed no malignancy, so ruling out a primary hematological cause. But what about an infectious workup? Well, stool microscopy revealed schistosoma ova, positive serology, as well as a strikingly elevated IgE level. So John had been silently carrying around a chronic schistosoma mansoni infection. Schistosoma mansoni is a parasitic flatworm that is transmitted through fresh water contaminated by infected snails. These snails release larvae, which penetrate the skin, go through the bloodstream, enter the mesenteric veins often, and lay their eggs there. Oftentimes, although the eggs get excreted in stool, many do get stuck in tissues, leading to a strong immune reaction, especially with eosinophils. This infection has two clinical phases. In the acute phase, you have flu-like symptoms causing the patient to have things like cough, fever, angioedema, often weeks after the infection, due to the immune system reacting to the migrating parasites. In the chronic phase, you've got egg deposition driving chronic inflammation, which is resulting in GI symptoms, especially as a result of it sort of sitting in the liver and in the intestines. And then in rare cases like John's, you'll have complications in the brain or in the lungs. So going back to our story, why did John seize? The most likely mechanism for this case starts with a chronic parasitic infection, which triggered a persistent immune response, leading to elevated eosinophil levels. This, in turn, over time, led to tissue infiltration by the eosinophils, vascular injury, and finally, to a hypercoagulable state. These hypercoagulable states then led to multiple chronic infarcts, which remained silent up until the damage accumulated enough to lower John's seizure threshold, bringing him to the emergency department with his first seizure. Oh. Let me just go back there 1 second. So what I wanted to say in terms of this slide before I move on is that this isn't just a story about a parasite. It's about a cascade of events, from chronic infection to immune overdrive to vascular injury, and finally to neurological consequences. So John was treated with praziquantel, and his eosinophil levels initially spiked, as expected, due to the immune system reacting to the parasites dying off, and then it leveled off. He was also started on Keppra for seizure prevention, and then aspirin to prevent future stroke risk. So what can we learn from John's case? 1, think beyond borders. Parasitic infections like schistosomiasis may lurk quietly in the background, and especially from patients from endemic countries. Eosinophilia is never just a number. Persistent elevations, especially with organ involvement, demand a thorough workup. And finally, what we can see is that not all strokes are vascular. In young patients without traditional risk factors, it's important to consider other causes, like hematological, autoimmune, and infectious causes. Thank you.
Right, who will comment?
Just a question about the EEG. Was it just once off, or did you run a 24-hour? Because it would be unusual if it's in an epileptogenic area that it remained negative.
Yeah, I don't recall that specific detail off the bat. I don't believe it was a 24-hour ECG. It was more of a limited time. I don't remember the exact duration.
What was the reason for the aspirin?
So initially, we didn't know what this was resulting from, so we didn't have a diagnosis. And so he started on the aspirin to prevent any future stroke risk until he was worked up. But now that he was worked up, he's then since been taken off of it.
So where did John get his schistosomiasis? And
Yeah.
number 2, you said the strokes are caused by the eosinophils plugging the arteries in the brain?
So great question. So the patient is from Guinea, a place in Africa. It's presumed that he picked up the infection there before immigrating to Canada. And then the second question you've asked about the eosinophils and how that's causing the stroke. So this is, the exact specific pathophysiology isn't clear, but what the thought is that there's a few different thoughts. One being that the state of hypereosinophilia in itself can cause a hypercoagulable state, primarily due to the granules released by the eosinophils, such as like basic protein causing injury to the endothelium, and then that being a nidus for thrombus formation and then embolization. Other sort of thoughts. This was our leading theory, but other thoughts are things like the granules itself release neurotoxin, and so could that have resulted in the seizure itself aside from the stroke, right? The stroke being something in addition to. Something we didn't think was the case here, but could have been, and it's arguable that it could have played a role, is, did the eggs, like the schistosoma eggs themselves, lodge into the vasculature of the brain, resulting that then leading the nidus for thrombus formation. We didn't see any abnormalities on CT angiogram, and really you would need like a brain biopsy to confirm that for sure. But that's also a thought.
Excellent presentation. On the MRI, did you have angiographic sequences, and did you have the opportunity to look at lesions that could be such as vasculitis, for instance? Because in the setting of eosinophilia, you have a number of issues related to vasculitis.
Yeah, no, that's a great question. Unfortunately, we didn't go that far. Something that we could have done, and if we hadn't gone to that diagnosis, something we probably would have done sooner rather than later. But that's not something that we've done.
I mean that one of the mechanisms could be also vasculitis related to eosinophilia, related to the parasitic infection.
This is correct. Yes.
Thank you. So if there are no other... Ali, please.
Thanks, Mehala. That was a great presentation. We often see minor abnormalities on the CBC, so I'm really glad you paid attention to the eosinophilia because often it's overlooked. People just look at the hemoglobin and white cell and platelet and they move on, and we see it all the time. Was there an anemia with this CBC, a complete blood count? Because often the most common cause of iron deficiency anemia in many low-income countries is schistosomiasis, and I'm just wondering if there was an anemia, like an iron deficiency anemia in association.
Yeah, actually, funny enough, everything else was like pristine in this patient's blood work, and so this was the only thing that was sticking out. So it was hard not to pay attention to it.
Well, thank you. Time is out, so
Thank you.
thank you so much.